from D.Y. Patil Hospital. She is doing her senior residency and working in Vitiligo clinic, and is involved in counseling of the patients as well as regarding the mental health status and psychosocial status also. She is presenting on color conscious mind and to investigate the impact of vitiligo on psychosocial and mental status of the patients. Over to you.
Thank you. A very good morning, one and all. Today I'll be talking about color conscious mind to assess the impact of vitiligo on psychosocial and mental health status of the patients. Vitiligo is a chronic pigmentary disorder influencing the patient's quality of life and psychosocial well-being. Instruments used such as Dermatology Life Quality Index and Vitiligo Specific Health Quality of Life instrument can be used to assess the disease severity. Psychiatric morbidity questionnaires like Beck's Depression Inventory and Straight Rate Anxiety Inventory can assess its psychosocial burden. We did this study to comprehensively map the psychosocial burden of the disease. Vitiligo was first developed by Lilly et al. In 2012. It is a self-report instrument containing 16 items for measuring the quality of life. DLQI was first developed by Finlay and Kohn in 1994. It is a 10-item questionnaire to assess the impact of skin in general on quality of life. This is an example of the questionnaire of the Vitiligo. Beck's Depression Inventory was first developed by Aaron T. Burke. It is a 21-question multiple-choice self-report inventory. It is one of the most widely used instruments for measuring the severity of depression. Straight Rate Anxiety Inventory was first developed by Charles D. Spielberger. It was further divided into S anxiety scale and T anxiety scale. S anxiety scale consists of 20 statements that evaluate how respondents feel right now at this moment. T anxiety scale also consists of 20 statements that assess how people generally feel. Respondents can be divided into top 25% comes under most anxious, bottom 25% comes under least anxious, and middle 50%. Our aim is to study the psychosocial burden and psychiatric morbidity in vitiligo patients, and our objectives are comparison of two quality of life indices, that is vitiligo specific health life quality of the index and dermatology quality of life index, to study the stigma associated with the disease and behavior pattern in vitiligo patients, and also to assess the anxiety and depression in vitiligo patients by using Straight Rate Anxiety and Beck's Depression Scale. We did this prospective type of study in our hospital with a sample size of 100. Inclusion criteria include patients suffering from the vitiligo, age being 16 years and above, and who are consenting for the study, and who are cooperative, and who can understand the questionnaire. Exclusion criteria include patients unable to understand the questionnaire. Patients were recruited from our vitiligo clinic and were interviewed based on the semi-structured interview schedule. Scales we used are DLQI, Straight Rate Anxiety Inventory, Vitiligo, and Beck's Depression Inventory after taking consent. All the 4 questionnaires were translated into local languages after taking permission from the authors for translation. Scores for all the 4 questionnaires were calculated and statistical analysis was done. And on observations and results and discussion, here we see gender-wise distribution of the vitiligo patient according to the Vitiligo and DLQI scores. The mean value for the vitiligo was seen higher in the females than in the males. The difference between the two mean values was not statistically significant. The mean value for the DLQI was also seen higher in the females than in the males, but here the difference between two mean values was statistically significant. Here we see vitiligo and DLQI scores according to the size of the lesion. In our study, it is statistically proved that it is maximum in patients with lesions on the exposed areas. Here we see presence of the psychiatric morbidity in terms of DLQI scores. In our study, it was 30%. The persons who have scored greater than 10% were considered as positive cases. The mean score for the Beck's Depression Inventory was 13.5 and the maximum score was 43. The mean score for state-right anxiety was 60. Beck's depression score showed tendency to be higher in patients with generalized lesions, intermediate in those with lesions on exposed areas, and low for those with lesions on unexposed areas. Similar trend was observed with state-right anxiety scoring. Here we see gender distribution according to anxiety and depression indices. The mean value for the Beck's depression inventory, trait anxiety and trait anxiety was seen higher in the females than in the males. And on correlation, positive correlation was observed between Vitiligo and DLQI, Beck's depression, trait anxiety scale, and negative correlation was observed between Vitiligo and age at onset. And under limitations, we have lack of control group. We have limited number of patients as a single researcher and limited amount of the time. If we would have more number of the patient, we have given better strength of association. And assessing the patients, which is subjective. From our study, we noticed that females have higher Vitiligo and DLQI than males. Stronger correlation between the Vitiligo and DLQI and Vitiligo with Beck's depression inventory and trait anxiety inventory. Mild depression was seen only in the 30% of the patients. However, more than 50% of the patients had anxiety. And on conclusion, vitiligo has profound effects on quality of life of the patient. The spread of the lesions is the most prominent factor affecting the quality of life. Psychiatric counseling will help the patient to improve the psychosocial well-being of the patient, to improve the quality of the life. The findings of this present study will create the awareness among the physicians to treating this vexing disease. Here are my references. Just because you are different doesn't mean it can't make a difference. I would like to specially thank to my HOD ma'am, Dr. Sharmila Patil, and my guide, Dr. Nitin Adkarni sir, and thank you a lot for listening.
For depression and anxiety, what was the score that you used? Did you use a PHQ-9 or 2, or what was the questionnaire that you assessed depression and anxiety?
4 scales we used that DLQI, Vitiligo, and Beck's depression inventory, and trait anxiety inventory.
So can you clarify the depression score? You said it was a depression.
Thank you for doing this study. Did you consider breaking down the Vitiligo into its 3 subcomponents: stigma, physical ability? And then the second question is, as you know, Indian patients have some unique issues that are not in America. Like, will my parents be able to get me married to someone else? Will the parents of my prospective partner be accepting of me? These are questions that are not as prominent, for example, in the United States. So for that reason, Dr. Ramam and colleagues at the All India Institute of Medical Sciences came up with a new quality of life score. I think it's called the VIS 22, which has some of these. Did you consider using the VIS 22?
Yeah, yes, sir. But we did this study in 6 months. We have limited amount of the time, and we have lack of control group also.
One last question.
I think in vitiligo, it's better to use vitiligo questionnaires like Vitiligo, but just general quality of life. There is a question about itching, and particularly in vitiligo, there is no itching in the vast majority of the patients. So you miss like they are 10 questions, so one is off. So it's not an accurate kind of measure because we've been through this exercise. We tried even to communicate with Professor Finley, who has established the quality of life, derm quality of life, but it's impossible. So there is, like, it's not accurate for vitiligo patients. But the excellent study, thank you very much. I agree with Professor Pandya about the VIS 22. This appears to be very suitable to Indian and Oriental and in our communities in Egypt as well. Thank you.
Thank you.
Thank you, Dr. Gumma. I have one question for you. What was the thyroid status in these patients, or the comorbidities in these patients? In your patient?
Ma'am, we taken patients who are with the generalized lesions and with no comorbidities also with patients.
What was the status in your patients, thyroid status and all?
Yeah, ma'am, we see in 30% of the patients who had, it's seen more in the female patient who are undergoing anxiety and depression.
So with the patients who are having more of comorbidities, they are more prone to go for this psychological component?
Actually, patients with lesions on the exposed areas who's having more anxiety and depression that we observed in our study.
Did you find any correlation with comorbidities also?
Yeah, yes, ma'am.
Okay, thank you.
Thank you, ma'am.
Thank you for your great talk.